Hello everyone, welcome to my channel A to Z Nursing Notes. I'm Rupinder and I'm back with another video regarding the CNO registration requirements. My previous video was regarding the CNO registration requirement, that is the jurisprudence exam, and this video is regarding the nursing education requirement. So how to meet the nursing education requirements for the CNO? Now when you have submitted your application to CNO regarding your RN or RPN category, they compare your nursing education from the back home with the Canadian nursing education standards. So based on that comparison, there are three scenarios that are applicable. First is that your nursing education is comparable to the Canadian standard. Another is that your education is somewhat comparable to the Canadian standard. And the third one is that your education is non-comparable. Now when CNO says that your nursing education is comparable, that means that you have met the nursing education requirements for the particular category, right? And sometimes it says that your nursing education is somewhat comparable, as it happened with my application in my RPN category, right? So it said that your education is somewhat comparable. So I was like, maybe that I will not be given the eligibility, but I was given the eligibility for to sit and write the exam, right, for the nursing registration exam. So there are chances that when the CNO says that your education is somewhat comparable, you may be eligible to write the exam. But when your nursing education is non-comparable, then there are three options which you can do. So what to do if your education is not comparable? So if your education is not comparable, there are three things that you can do. Either you can complete additional nursing education, or you can get yourself evaluated at the Touchstone Institute and give the OSCE exam, or the third one is that you can give the NCLEX exam from another country and meet the educational requirements as well as the registration requirements of the particular category, right? So coming to the first category, that is completing the additional nursing education. So this thing, it may vary according to person to person, right? So it is based upon your education, how old is your education, like whether it was 10 years back or whether it was 2 years back. So when you have completed your nursing education, that according to that, the type of additional nursing education you should get, that varies, right? So what happens exactly is that the CNO evaluator checks your nursing education and then sees what all fields or what all nursing skills or competencies are met or you have already done in your previous study, and what all things are there which are new to the or what are things are there which have been added over a period of time since you have got the education, right? So based on that, the evaluator makes a report that is called the competency assessment form, and in that competency assessment form, they write down the competencies that you are missing, right? So according to that, you get the competency assessment form in which you have the competency gaps, and you have to take those competency gaps into account while getting your additional education. It is not that you can go to any particular college and get your some other kind of nursing education and that fulfills or satisfies your nursing education. No, it's not like that. It will differ person to person. It is not same for any two applicants. It cannot be same. It may be same, but it cannot always be same, right? There may be one or two competency gaps that may vary. So you have to fulfill all those, or you have to meet all those competency gaps in order to get your a nursing education criteria met, right? So once you get the competency assessment form from the CNO, you have to contact particular the approved nursing colleges or universities in Ontario that are registered and accredited by CNO, and show them or share with them the competency assessment form of CNO, and based on that you have to they will suggest that okay, this is the nursing program which fulfills all these competency gaps and you should go for it, right? So you will take up that course, and after completion of that course, the school will send the transcript of that particular course to CNO directly. It will not be sent by you, it will be sent by the school directly to CNO. And then your application will be reviewed again once your education is completed, right? So the additional education, it must meet the criteria for additional education and training. So there are some criteria which your additional education should fulfill in order that CNO accepts your education. So it is not always that CNO will accept your education. There may be times when CNO will say, okay, it has not met this criteria, so we are not accepting your education, and you have to go through the process all over again. Okay. So what are the criteria? First is that it depends, right? Like if you are, depends upon your application, whether it is the RPN category or the RN category. So like if you have you are applying for the RPN, then the education would be related to the RPN level of education. And if it is in the RN category, then it should be like you should apply to the courses which fall in the RN nursing education level category, right? Another thing is that the university or the college from which you should be doing your additional nursing education, they must be accredited, recognized and approved by the CNO, right? So there is a particular list of approved colleges which can be found, and the link I have mentioned in my slide, and you can check the colleges which are approved, which are under approval process, or which have been approved, fully approved. So there are different categories, right? So based on that, you can choose your college and go ahead with your nursing education program. Also, the learning objectives and the purposes of that particular course, they should be clearly written. And if there is any clinical placement associated with your nursing education, then there should be some kind of rubric or performance evaluation based on which the student will be evaluated for their clinical skills, right? So this is one of the requirement of CNO. Another is that they should address the competency gaps outlined in the competency assessment form. So there are like 30 competency gaps in your application, right? So the nursing programs which you take up, they should meet all the 30 competency gaps, right? If suppose whatever course you have completed and you have sent to the CNO, and if the competency gaps are not met, then again your nursing education criteria will not be met, and the remaining gaps you will have to again fulfill by completing another nursing education program, right? And you can choose to do the additional education from any approved college or university, and it is not mandatory that the college should be in Ontario. You can do it from another college which is outside Ontario. So this is not a hard and fast rule. The second method is that there is an institute called Touchstone Institution, and you can get yourself evaluated at Touchstone Institute. So what the Touchstone Institute does is they supply you with a particular set of MCQs, they interview you, and then they give you OSCE, that is objectively structured competency exam, which takes place in a simulated setting. And based on that, whatever, like suppose you have done the MCQs, if you have given the interview and you have given the OSCE, so based on that, they will give you a chance to demonstrate your nursing education skill and judgment in order for you to meet your competency gaps. So whatever, like you have gone through all of the process, and whatever competency gaps you have met, so those will be removed from your competency assessment form, and still whatever gaps are left, you can like take up small course or something like that to meet those exam gaps, right? So the CNO is already like in touch with the Touchstone Institute people. So once they generate your evaluation report, they send your email ID to Touchstone Institute, and the Touchstone Institute contacts you via your email address so that you can get yourself evaluated by this institute. Now, what exactly is Touchstone? Touchstone, it is an institute which runs the Internationally Educated Nurses Competency Assessment Program, and this program has two components. One is the MCQs or the multiple choice questions, and the other one is a 12-station OSCE part, right? So the OSCE, because of the COVID, it has been made virtual as also, and as well as in person also. So the cost of the MCQs plus in-person OSCE is $1,500, and the cost of the MCQs and the virtual OSCE is $1,750, right? So it is your choice which category you want to go further with. Now, what are the steps to register with the Touchstone? So the Touchstone, they send you the email, and in that they have the sign up link of the Touchstone website, which is the link I have written in the slide. So you go onto that portal and get yourself signed up, just like any other social media website. You just sign up and then you sign in, right? So you will just do the sign up process, that is, you will generate your user ID and password, and they will tell you then again by email, they will contact you and let you know that they have their registration open, like they will be having the dates for the exam open, so you can log in and book your exam dates, right? So you will go to the Touchstone website, click on the INCAP exam tab on the top of the page, and you can select whatever date you want to select for your exam and click apply for exam button, right? And you are not required to pay a fee at this moment. Now what this process does is that they book your seat for the particular date, right? So you have shown your interest that you want to give your exam on this date. So if the Touchstone has the enough seats that they can accommodate you, then they will contact you, and then you will go further with the payment process and give your exam, right? Now the third part is to give the NCLEX exam from another country and meet the educational requirement as well as the registration exam requirement, right? So this is like ek tir se do nishane, theek hai? So in this, the candidate who have passed NCLEX RN exam from another country like USA or Australia, their educational requirement will automatically be met. This is the new rule that CNO has given amid COVID to meet the nursing staff shortage, that whosoever has already given the NCLEX exam since April 2013, right? So if somebody has given the NCLEX exam, their educational requirement is not met earlier. So now their education, they are able to meet their educational requirement based on their NCLEX RN exam, because they think that if somebody has given the NCLEX RN exam and passed it, this means that they have the necessary education skill and judgment for the nursing, for providing nursing care which is safe and appropriate for the patients, right? So this is another way for you to meet your educational requirement. So this is option 3 is a separate thing, but again option 1 and option 2, that is the additional nursing education and the OSCE, right? So this is again suggested by the CNO, whether it gives you the option to either go for the additional education sometimes or only go for the OSCE, or it depends, it gives you the option to go for either OSCE or the additional education. So it may vary again according to this person to person what CNO decides about your application, right? It is not the same for everyone. It varies according to person, application to application, right? So read your CNO report carefully, whether it says that you will only do the additional nursing education, or you will have to give the OSCE, or you may give either OSCE or do the additional education, right? So again, I always give important tips in my videos, so there are some important tips for you. As other forms you send in the CNO or the NNAS application, these forms will also not be sent by you to the CNO. Whatever institute from where you have taken your nursing education, they will be sending the transcripts directly to the CNO, and they can send the transcript by one of the following methods. Either they can send by mail in an official envelope, but then it should be having the signature, seal, stamp and logo of the signatory or the organization who is sending. Second option is that they can send the transcript by email to the CNO at the address eap@cnomail.org, or they can send the documents by fax to the number 416-928-6507, right? Also, whatever documents they are sending, you must mention to the institute that they have to write the attention part. They have to write that this is related to entry to practice, and in the subject part as your name, whatever your name is, and your application number, your RPN application or your RN application number, right? So you have to mention these two things in your documents, right? Also, there are questions in the people's mind, like suppose you have got your CNO advisory report. Now, how long your application is open so that you can complete and meet all the CNO requirements. So once you have got the CNO report, the CNO, it keeps your application open for 2 years, right, in continuity, even if you have not updated anything. So you have 2 years to update even one of the categories. Like suppose you were busy somewhere, you like some family problem happened, right, and you were not able to meet take care of your CNO application. So like suppose 18 months have passed, so you can just get your give your jurisprudence exam, right? So within 2 years, that is a 24 months period, you have updated your application. So your application will remain valid for again two years, right? But if you do not update your CNO application for 2 years in continuity, it will automatically get expired, right? Then you will have to start a new application with the fee, and you have to reapply in that category, right? So that's all for today's video. Thank you for listening, and do you have any questions for me? Please let me know. Thank you.